Another major pharmaceutical company today releasing preliminary results of its vaccine. Among 30,000 participants receiving the two-dose Moderna vaccine, there were a total of 95 cases of symptomatic COVID. All but 5 were in the placebo arm, meaning the vaccine was 94.5% effective. There were also no reports of any serious side effects. Just last week, Pfizer said its vaccine was more than 90% effective. Thanks for joining us tonight. As we see these promising results, health officials in our area are planning how to best roll out vaccinations to the public.
Madeline O'Neill explains what goes into that process and when you might be able to get the vaccine. Maddie?
Well, there's still plenty up in the air. More questions than answers, as one Unity Point Health Meritor official told me today. But that doesn't mean they're not planning. They have to be ready for when the pieces fall into place. We're all ready for a vaccine.
All of our hospitals are getting very full.
Perhaps no one more than the frontline workers.
We're getting tired. We're getting stretched.
Nathan Bubenzer, Emergency Preparedness Safety Manager at Unity Point Health Meritor, says healthcare and essential workers will be among the first to get vaccinated as early as next month, as top health officials from the state and CDC work on a tier system.
It's going to be relatively limited supply initially.
The vaccine would then likely go to vulnerable populations like the elderly before the general public, which Bubenzer estimates could happen in early spring. As far as distribution, it will likely be a mix of appointments with healthcare providers and community vaccination options. In a statement, Public Health Madison and Dane County says they are working with partners to plan for equitable, ethical, and transparent distribution of COVID-19 vaccines.
It's again a giant step in the right direction.
Earlier on Live at 4, UW Health's Dr. William Hartman said while both the Moderna and Pfizer vaccines appear to be more than 90% effective, Moderna doesn't have to be kept at such ultra-cold temperatures, making it easier to distribute.
But that is a big variable, figuring out how to store and then use in a timely and safe fashion.
Health officials must also make sure patients are completing their vaccinations in a timely fashion, when both the front-runner vaccines require 2 doses.
Tracking all of those pieces is going to be vitally important.
Also important, not getting too ahead of ourselves.
This is just another adjunct, another tool in the toolbox.
Whatever we can do until a vaccine comes and even after a vaccine comes to minimize that spread is vitally important right now.
Another component of this, of course, is making sure the process is safe and letting people know that it's safe so as many people get vaccinated as possible. The Meritor official I spoke with today said that at minimum he'd like to see 50% of people get the vaccine, but ideally that number would be more like 75 to 85%.